I am Dr. Dooley. I am a doctor for Bernie. I am a black woman for Bernie. And there are several reasons why I support Senator Sanders. It's not because of his rugged good looks or his stellar sense of fashion. Those are the reasons. Because I'm a thinking woman. So he caught my attention in 2016 with 6 words that I wasn't used to hearing politicians say. And those 6 simple words were health care is a human right. And as a black female physician, particularly, that especially touched my heart because I'm really passionate about ending health disparities. A health disparity is when people of color have worse outcomes for almost every illness imaginable. How black women are 3+ times more likely to die during childbirth. How black men are more likely to die from even low-grade, mild forms of prostate cancers. How black women are a little less likely to get breast cancer, but we're more likely to die from it. These are the realities I see and fight every day. And when we think about something like healthcare, African Americans have been fighting for the right to not die from illnesses that are too expensive for us to afford since we were first freed slaves. So they freed us, but they didn't give us hospitals and doctors. And then we finally got some hospitals, but they were segregated and they weren't funded and we didn't have the medications that we needed. So when plagues came through our communities and we died because of it, they used the fact that we died because they didn't give us the medicine and the resources that we need to say that we were a weaker or lesser race. So we have been fighting for the right just to have health care since we were freed slaves. And if you look at the history of this nation, every effort we've made to ensure more people, whether it be Medicaid or Medicare or the Affordable Care Act, every single time there is still a disproportionate amount of poor people of all colors, black and brown people who are left uninsured after every attempt we've made in this country. I don't think it's a coincidence. Black women are still twice as likely to be uninsured as people of color. The only way to guarantee that all people who look like me have health insurance is to ensure everyone, because if everyone is included, nobody can be excluded. And that's the way it should be. I'm going to tell you a couple stories. I have a young man who came to my office. He had diabetes, living with diabetes, couldn't afford his medicine, came in, he had saw an eye doctor, and they saw some changes in his eye because of the diabetes, and he was worried and scared that he was going to become blind. So I said, hey John, why haven't you taken your insulin in 4 years? John said, well, Dr. Dooley, I had insurance, but I was making $9 an hour, and I had a $5,000 deductible, and my insulin was $250 a month. That's a car note. How do you afford $250 a month when you are making $9 an hour? There is no place in this country where somebody can afford a 2-bedroom apartment on minimum wage. Right? Another story. Maria was Latinx female. Maria was working 2 jobs to take care of not only herself, but other undocumented people in her family. Like most Americans, Maria didn't have a savings. So when an unexpected bill came, something happened to her car, engine, transmission, something like that, she had to decide between paying her rent or fixing her car. Well, if you don't have a car, you can't go to work. So of course she fixed her car. Then she became behind on rent. By the time she came to see me, she was facing eviction and homelessness. And she had 2 jobs. She had insurance. She did nothing wrong. So I'm like, okay, Maria, I want to get you to a mental health therapist. Because she has one of these high deductible plans, it would cost her $50 a session just to see a mental health therapist. I'm like, I wanted you to see them once a week. So you're going to tell somebody who's facing homelessness and eviction that they have to have $200 a month just to speak to a mental health therapist? Third story. Richard, white male. So the Affordable Care Act, you're allowed to stay on your parents' insurance till you're 26. Then what do? I guess you just die because you can't afford your insulin any longer. But anyway, so because we have all these insurances here in the United States, his parents had a decent insurance in Michigan. But he went to school somewhere on the West Coast where his parents' insurance wasn't a popular insurance in that state. So he had mental illness, depression, and anxiety, needed help, but could not find a psychiatrist, a mental health professional that would accept the insurance that was a big insurance in Michigan, but not a big insurance where he lived. Did nothing wrong, had insurance. Ended up having a suicidal attempt. Parents flew him back home. They bring him to me. So I'm saying, okay, we're going to get you to a psychiatrist. We can get you in. It's going to be about a week. But let me draw some blood work. See if there's anything physical going on. It's not the cause of your symptoms, but maybe it's something that's making your symptoms worse that we can fix. So I draw some blood work. I see, okay, we can work on this thyroid. We can work on this vitamin D. It's not going to cure him, but maybe get him feeling a little bit better while he's waiting to see a psychiatrist. So I call him and say, can you come in, let's talk. I know you're not seeing the psychiatrist till the next week. Come in, let's talk about some of your blood work. He says, I can't come in today. Can you come in tomorrow? Can't come in tomorrow. Okay, the next day, can you come in? Yes. So I'll never forget it. The day of his appointment, which was 2 days after I called him, it's the only time this ever happened to me, that I had the police call me to cancel an appointment for a patient. They said he will not be in today. His parents wanted you to know he hung himself in the basement the day of his appointment to see me. Because when he was away at school for months, he had insurance. He did nothing wrong. He had insurance. But because we dictate your insurance on what state you live in, he could not get the care that he needed. And he died. So this is something that we should be able to rally around. I told you a story of somebody who was black, somebody who was Latino, somebody who was white. This is an issue that we can rally around together as Americans and fight for it. But Dr. Dooley, I don't want to pay for somebody else's hip replacement. Okay, I get that sometimes. Well, first of all, you don't understand how insurance works. When you have insurance, if you don't use it, the money that you pay into it takes care of somebody else. And second, most of the time, that's racist. Because what you're talking about somebody else, you don't want to pay for somebody who's black or brown or somebody who's undocumented. Okay? And then we have all the wealth that we need in this country to take care of everyone. We know from the studies that it's going to save money. And it's just the right damn thing to do. Mm-hmm. So when you go out, there's a quote. There are some that fight for a day, and those are good. Others that fight for a week, and they're better. There are those that fight for a month, and those are better still. But then there are those who fight for their whole damn lives, and those are the indispensable ones. We would not be talking about Medicare for all if Senator Sanders wouldn't have ran on it in 2016. We have a rare opportunity in this election to vote an indispensable one. Someone who is fighting for somebody who did not know his entire life. As a white male, he didn't have to fight for civil rights for poor and black and brown people. He has been fighting for somebody he didn't know his whole entire life. Senator Sanders is an indispensable one. And together, we are going to get him to the White House, and we are going to change the world. So please remember that when you knock on those doors, there is a need behind every door. Maybe it's health care for somebody. Maybe it's cancel student debt for somebody else. Maybe somebody needs some workplace democracy. They need a union. Maybe somebody needs their student debt canceled. Every door you go to, there is a need. And by knocking on doors and joining this movement, you are changing the world. I appreciate you. I am proud to be part of this movement with you. We're almost there. I just dig a little bit deeper, sign up a couple extra shifts. And please, when I travel all these early states and I meet people, I say, did you early vote? And they say, yeah, I did. The vast majority of the time it's for Senator Sanders. And then I say, well, why? And they said, because somebody came to my door and they told me about him. Because somebody came to my door. I'm not diminishing the importance of calling and texting, but we are going to win this race by making individual contact with people where they are. So know that you are changing the world by being part of this movement, and I love you all.